Hello, this is Dr. Gay from First Lick MRI. And this is a 17-year-old male with complaints of foot pain beneath the great toe. He plays basketball and recently injured it. Now has had difficulty walking. And we see a couple things here. This is an incidental finding along the lateral part. This is the fifth metatarsal head. Beneath that we see this big mound of intermediate signal within the subcutaneous fat. We see the bright fat through here looking normal, and you get to here and see this big mound. So this is an inflammatory response. We call this a pressure lesion. When they have too much pressure over here, they get this reactive fibroblastic response in the soft tissues, and you get this mound. This is much bigger than usual. These are very common. You typically see them if you look for them along the lateral side or plantar side of the fifth. Sometimes the first metatarsal head beneath it will have a small pressure lesion, but we just call it a pressure lesion and throw it as an aside. And a lot of times people don't complain of these very much. We just notice them incidentally, but this one is much bigger than usual. Now the real finding is over here where they have the pain, and we see that the lateral sesamoid looks pristine, nice normal signal. The first metatarsal head looks great, and then the medial sesamoid bone looks totally abnormal, really low signal, really kind of profound low signal. So this can be related to just edema. We'll have to look on the other sequence to see, or can be related to reactive bone sclerosis. With an injury, they can have trabecular microfracture or too much stress and get reactive sclerosis. And with sesamoiditis in the acute phase, usually it won't be so dark on the T1 weighted sequence. So if we go to the PD fat set sequence here, we don't see really prominent hyperintense signals. Pretty intermediate signal, a little glaze of brightness, and here's some dark area down here, so probably reactive sclerosis and some minimal edema. And so this is related to injury where they have trabecular microfracture and some mild reactive marrow edema, but there's no collapse of the sesamoid bone. You could just call this a stress injury, a stress fracture, but no evidence of a collapse. Again, the lateral sesamoid looks great. And the next thing we want to look for is the plantar plate to make sure they don't have a turf toe or associated injury. They do have some edema going along the medial and plantar side of the first metatarsal associated with that recent injury. And now we're going to just look at the anatomy here. So if we go back into the foot, we have some muscles and tendons here. So we have the medial muscles here are the flexor hallucis brevis, medial and lateral muscles. And they're going to come down distally, and they're going to attach right to the sesamoid bones. They come right down and attach. And along the medial side and along the lateral side, we have a tendon. They kind of blend together. It looks like the central tendon of these muscles, but this is actually a separate central tendon. This is the abductor hallucis tendon, and this is that muscle here, the two medial muscle bellies. And over here we have the adductor hallucis, and they're also going to form part of this plantar plate. They're going to hang out the far lateral side and medial side here. And between the sesamoid bones we see a little dark area right here, the sesamoid ligament right there. That looks like it's intact. And also we see the flexor hallucis tendon right there looking normal. Now this is a sagittal view. You can see the flexor hallucis tendon coming across here along the plantar surface between the sesamoids. If we go over to the abnormal one, this is the sesamoid bone, the medial sesamoid that's abnormal. A little bit of fluid here. We have the muscle, the flexor hallucis brevis muscle coming down, and it just attaches right to that sesamoid bone. And then distally we have the sesamoid phalangeal ligament that comes off the sesamoid and goes to the base of the phalanx. This looks like there may be too big of a gap up here. Some of the ligament is intact, but over here there's a area of brightness, and you can have a small little defect here. This looks like it may be too big, so this may be partially torn, but it's not ruptured. When they're ruptured, the sesamoid bone will drift backwards, and again, it's not even thick, so this is a questionable finding. But again, there's no plantar plate rupture. The sesamoid bone is in normal position, so this is, again, mainly stress reaction or stress injury of that sesamoid bone. Now if we go off to the lateral sesamoid bone, we're going to look for that sesamoid phalangeal ligament. We see this dark glob here. This is that ligament. It looks totally intact. There may be a little tiny cleft right here, which is normal, but there's no big gap. There's no retraction. If we go off to the other side, we see that it looks like there may be starting to become a little bit of a gap, and we have this defect that's too large, but there is an intact ligament here, and this is not drifted backwards. So in the end, we're left with an injury of the medial sesamoid bone, a prominent stress injury with reactive sclerosis and a superimposed marrow edema, but no collapse, and edema around it, and maybe a mild injury of the plantar plate, but no plantar plate rupture. And we also have this big pressure lesion beneath the fifth metatarsal head. Thank you very much.